I'm Dr Natasha Schoeler, and I'm a specialist paediatric dietitian and senior research fellow working in ketogenic diets. As part of our research study, Keto Start, I've been lucky enough to speak to a range of families who have been on a ketogenic diet journey. The aim of this video is to give a realistic representation of what it's like for families to start or to be on a ketogenic diet. And we hope this will be helpful for healthcare professionals who are working in ketogenics to help get a better understanding of what it's like from the other side, ultimately to help improve our patient care.
When we introduce ketogenic diet, we start off with this one appointment when we talk briefly about ketogenic diet and basics of it and what the food will look like for the family and what the challenges might be.
My name's Kath. My daughter is Olivia, who is now 9 years old, and she's been on the ketogenic diet now for 5 years.
I have mayo, crisps and ham. My mum packs it in a little box and then I put it in my lunchbox, then I close the zip up, then I go to school. Well, they say, what a yummy dinner.
My name's Marie. I am the parent to a child with complex needs and complex epilepsy. Her name's Amelia and she has been on the ketogenic diet for approximately 12 months. I already knew about the ketogenic diet prior to being referred, and I think I asked for it before anybody suggested it. We had 3 sessions and I think they were a few weeks apart. And I think that was really helpful because it gave me a chance to do the first session, digest, then also read around the type of stuff that they'd covered and relay it to my husband who was at work, so not on those sessions.
We had phone calls, we had Zoom meetings, we were really supported from the get-go.
They explained literally everything, right down to the nitty-gritty, so yeah, it was really helpful.
We support our families with providing diet plans, helping them out with feeds that are ketogenic.
I'll usually take a diet history, their food preferences. I'll just try to give them recipes that they usually eat. It's a diet they have to stick to. It's not like they have a keto breakfast, then they can have a normal lunch. It's like committing to the diet every day for a period of time.
But also you might not see benefits from ketogenic diet immediately. What we usually say is we try to give it 3 months.
That's the sort of commitment required. And also the daily monitoring, and also the commitment to attend the clinic like every few months.
Mostly families want to know, what will my day-to-day look like from now on? What food will I be able to give to my child?
I'm Hattie. I'm 10 years old and I've been on the ketogenic diet for 3 months. Well, when I see like other people having like ice creams and stuff, I get a bit jealous.
Working full time and having a child who is on the ketogenic diet and has, the needs of her epilepsy as well is a challenge. When I got home from work and we found initially she was really hungry, so it was kind of like, I'm really hungry, Mum, what can I eat? And we didn't have stuff prepped. That was difficult. Having the time is the biggest thing, just being able to think, right, lay all your ingredients out, look at your nutritional kind of information on the back, work it all out.
My favourite chocolate is dark chocolate. I'm only allowed 8 grams of it, which is a very small amount, but it's still really nice.
Initially, there was definitely a shock at how much these things cost. For example, I ordered Hattie some fat bars from Amazon. They're £2 a bar. The meat, cheese, butter, the milk is expensive. I think one of the biggest things for me was when she stopped having fruit, because it's all about 5 a day, 6 a day, however many a day you're supposed to have. And then all of a sudden you can have 3 raspberries. And that was a shock. And I think in the back of my mind, there is always, what impact is that having on her long-term health?
A lot of our families are saying, oh, it's all kind of dripping and it's all very liquid because of the amount of fat or double cream or butter. But of course there are ways to make food crispy, so we can definitely help with those recipes.
Hi, my name is Chloe. I'm Tia's mum, and Tia has been on the diet for 2 years. I just knew that it was an option and you try anything when she was going through so many seizures. So yeah, it was just a bit, let's just try it, but it is very calculated. You've got to make sure everything's right, you've got to make sure she eats it all.
You know, you're weighing food, you've got a calculator that you've never had to use for food before. It's so detailed, and I think it's very difficult in the early days. And what I would say to a family is it gets easier, you get used to it, it just becomes normal, it becomes second nature.
My name is Alice. I have a 9-year-old son called Eli, and he is on the ketogenic diet. I think people just stick their head in the sands and say it's going to be too hard. So before you've even attempted to do it, the wording is all about how hard it will be and how, even if it was successful for seizure control, it would be too hard.
I think it's really difficult for a health professional to manage expectations. I think it's a very fine line between managing somebody's expectations and drastically putting them off.
I'm Ella. I was 13 when I started the ketogenic diet. I had to kind of balance school and being on the diet as well.
Yep.
So I had to bring the foods I had to take and the drinks. It was awkward because I'd have to explain to everyone that I was on a diet.
You're changing, it's not just a diet, it's more of a lifestyle.
I tried a lot of recipes from a ketogenic diet and they honestly tasted horrible, mainly the drinks. It was quite time-consuming because the instructions of a recipe didn't quite go into detail. Also, we didn't have machines to make some of the things, such as, because I think there were smoothies and we couldn't make it because we didn't have a blender.
In some sense, I was physically and emotionally drained.
I think she felt anxious about not being able to have the foods that she liked as well.
Families are quite often anxious about the amount of fat that they are now introducing into their child's diet, because I think overall, for our whole life, we've been listening to a lot of people saying don't eat fats, but as I tend to say to all of the families that I'm working with on ketogenic diets, you're burning that fat, so you are actually putting that fat to good use. You're burning that to get ketones that will then help your brain fight seizures.
I'm Hope. I was on the ketogenic diet for 2 years and I'm 17 years old now. The most difficult thing about being on keto has to be the overwhelmingly large amount of fat. Everything I just realised was more or less brown. Mayo and butter are your best friends.
School did try, one of the things they did try was to meet her nutritional needs at school, but then they found it too complicated.
Hi, my name's Selena and Yanis is my brother and he's on the ketogenic diet.
My hardest bit of the diet is watching my sister eat stuff that I'm not allowed, but also I know why I'm not allowed to have it.
I felt kind of bad sometimes because I can eat stuff he can't and he gets annoyed about it.
I was very glad because I was hoping for him to have something for him to try to have a normal life. It was very challenging and sometimes I was even crying because I say how hard it is, to say to your proper child you can't eat. But at the same time it was for his best. And it's hard, I know, I understand, but if you want to get better, it's the only way.
I think overall, what we do to help families with that is we introduce ketogenic diet really gradually and slowly, and we take family's pace rather than our own pace.
So some of the difficulties we see at the early days also are that they might not have achieved seizure improvement as they wish for.
So one of the problems that we have is the GPs. They can often send a prescription to the wrong place, and this can be a real source of anxiety for the families as well, because they are often very reliant on the prescription items that we give them.
Having been on diet for 5 years now, I think Olivia's had enough. She hates every single fat source that she can have. So we have incorporated normal foods back in for her, but in a very small quantity.
Another challenge that I see quite often is blood monitoring, because I think some families are just not used to doing that every day. But again, we do it really slowly, gradually, and you have time to adjust to that. I think one of the disadvantages of multiple different services is that mostly we work during weekdays only from 9 to 5, and families quite often, whenever they're going through something really stressful, from experience it always happens on a Friday evening, and we're not there.
At first, the dietitian was super responsive and super helpful. The replies can be a lot slower. She's still incredible, but it can be frustrating when you're just not getting an answer as quickly as what it was at first.
I think there's a lot of support required as well in maintaining motivation, that they continue, and that is often easier when they see seizure improvement.
They also do arrange cookery days, so they can learn how to cook these recipes and ask any questions that they might have about any of the recipes.
I find the ketogenic forums invaluable, where other parents are allowed in to join. I remember one Christmas someone had found an advent calendar where each chocolate was under 1 gram of carb, and I immediately went out and bought it.
So I'm a member of the Daisy Garland Keto Cafe, the closed group on Facebook. I'm not confident enough to post on there yet, but that's been a wealth of kind of information really, and it's nice to see other families in a similar position, and they're great at putting ideas on there, so you feel like you're not on your own.
And you can speak to people that have either been on the diet a very long time, have been on the diet and come off the diet, are still on the diet, and you get lots of on the ground real life hints and tips from families that have lived it and breathed it.
Some of the ways in which we help families are products on prescription that are ketogenic friendly, that look like your normal kind of chocolate bar or maybe like your chocolate pudding, but is actually a ketogenic product. I think the most important and most helpful thing that I can do for my patients is just to be there for them, because of course every family will need something different.
So in my experience as a pediatric neurologist, I've seen many children and young people who have benefited greatly from the ketogenic diet. We know that it does not work in everyone, but in the many where it can work, it is amazing as it gives seizure freedom and amazing quality of life as well.
We had 3 or 4 months of seizure freedom before they lapsed back in, but we could not replicate whatever it was that was right in that time. But we did notice that the medication side effects, the sort of, I call it zombification, where she's not quite all there or she's a bit less cognitive, improved completely with keto.
So one thing I did find useful was Matthew's friends pack, the starter pack that they sent out. So the menus were really helpful.
Certainly the box that we were sent by the Daisy Garland was brilliant, because that made it a really positive experience for her. She really enjoyed trying the foods that were in there and all the nice things, like she got a lovely avocado teddy, which she really loves.
The best thing about my ketogenic diet is that I still get foods similar to foods I used to have when I was off the diet. My dad does a really awesome keto pesto chicken.
There were times when I thought, we're not going to be able to do this. But I think we've been on it now for 3 months. We've got a special freezer for her. Each drawer in the freezer's got different foods, and we've now got like a bank of recipes that are our go-to. We had our first 8 days of being over 2 with ketones. So yeah, just keep going, don't give up.
It's hard, but you can get through it.
She couldn't sit up, she couldn't walk, she couldn't verbalise. She had a really poor quality of life. She went keto from day 1, which by 6 weeks she had full seizure control. Now she can sit, crawl, bum shuffle. She makes you aware of what she wants, and she's learning to walk in a walker. I'm really, really proud of how far Tia has come.
Before, we couldn't go outside because we never know when the seizure would happen. We never know because it was so bad. It was so bad. But now we can have some plan going outside. I will never go back because it helped us a lot, a lot, a lot.
He has less seizures and less drugs, and that means we can make plans more easily. Like we can go out more knowing that he'll be okay.
My favourite thing about my ketogenic diet is I have less seizures. I hate broccoli though. I'm going to keep going.
So we just plan our meals out for the week as a family, and then I just sort of correlate his meal plan as such to whatever we're having. It just means that he feels sort of connected as a family at dinner time. Because Eli could actually see a benefit to his seizures, he realised actually this is worth continuing.
I have recently been to 2 keto days myself, where a ketogenic chef is there to literally ask questions. But I think those days are amazing because you can learn about new products, you can see other families on keto, and that was the crucial thing for me. And I think I would also make a plea to all the neurologists to be supportive, because in my own personal experience, I was told because she had no real improvement after 3 months that it was unlikely to work.
If you are about to start your keto journey with your child, I would just say you just have to persevere, and at the beginning you might not see any real benefit, but if it's going to help them, it will get better.
Talking to other people in the same boat is really key to finding out different tricks and tips and hints that may or may not work for you.
There are millions of recipes that you just don't realise you can hide fats in. And a lot of the meals can look really similar. The pizzas, you can make fish pies, you can make chips so long as with a celeriac. There are all these options where food can be transferred and adjusted to be keto friendly.
What I would say to someone who's about to start the diet or thinking about starting the diet is just go for it. There's nothing to lose.
Don't give up, especially in the initial stages when it's tough. Just keep going.
It's worth all the hard work, it's worth all the weigh-in, it's worth the inconvenience. Whatever difficulty there is around the ketogenic diet, it is worth it. Our child has gone from 100 seizures a day to less than 5. And that's thanks to the ketogenic diet. And no bar of chocolate in the world is worth watching your child have a 5-minute seizure.